Well, thank you again, everyone, for being here. Very, very excited to be hosting Dr. Galea, and I'll start by actually introducing what SEAL is. So, SEAL is the Social Equity Action Lab, and it's an organization that serves as an international youth-led forum researching health policy issues, as well as advising electoral candidates and elected officials on pressing health policy matters. We also work with health systems and nonprofit organizations to engage in research with them and move the needle on health care improvement broadly with a focus on equity and social determinants of health. And so, with all of that, I will hand it over to my colleagues Arnav and Urvish to introduce our esteemed speaker, Dr. Galea, and start the event off. Thanks again.
Thanks for showing up, guys. I'm incredibly honored to introduce our speaker, Dr. Galea. He's a physician and epidemiologist with over 1,900 publications and 20 books on social determinants of health, war and trauma mental health, and health policy. He's also the inaugural dean of the new WashU School of Public Health, editor-in-chief of JAMA Health Forum, and one of the most prolific, impactful, and most importantly, kind voices in public health today. Today's conversation will explore Dr. Galea's path from immigrant and physician to national public health leader and how he really balances moral clarity with public scholarship, and how we, as students and early career changemakers, can build careers that stay close to values while scaling real impact. We'll begin with a few questions submitted by SEAL members and then open it up to all of you to raise your hands and ask questions. Please also feel free to drop your questions in the Zoom chat throughout the event. We'll do our best to get to as many as possible. Dr. Galea, thank you so much for being here. We're so excited to learn from you.
Thank you for having me.
Yeah, and I can start off with the first question. This is from all the SEAL members. How will public health have to change as a field over the next 50 years as we shift to face novel challenges like aging populations, high chronic disease, and mental health? And how is WashU's new School of Public Health thinking about facing these challenges differently from other academic institutions through its work?
Yeah, thank you. First of all, thank you for having me. Thank you all for being here today. So this is a moment of unease in health. I think everybody knows that. I think it's unease in the structures that generate health. It is unease in universities. We have a federal administration in the US that has acted in many ways counter to what previous administrations have done. And I think it's easy to, in a moment like this, to think that this is a one-off discontinuity. But I think it's important to recognize that what's happening in the moment really continues a number of changes that we have been experiencing and seeing in health over many years. And a number of things have been happening perhaps faster than we are used to, but they really represent a growing sense, I think, in large parts of the American population and in America's interaction with the world, that there are some elements that we should be rethinking of how we do what we do. I've written a little bit about this under trying to think about what new directions we might want to think about as a field, and I've articulated this sort of in 4 areas. I think number 1 is we do need to learn how to think differently about health. I think we are in a moment in time when the paradigms that have served us well over health, and by served us well, I mean contributed to an extraordinary increase in life expectancy, are no longer serving us as well as they should be. I think we're seeing that as you see a number of popular movements like the Make America Healthier movement that really are in response to some of the challenges that come with us being in a country which spends more on health than any other country, but gets worse outcomes than other countries. And so I think we need to think differently about what health is, why we do what we do for health, and what it is that actually generates health. That's number 1. Number 2, I think we are at the cusp of new approaches. I think there are new approaches to be embraced as we think about health. I think the AI revolution, which one I think might be forgiven for thinking there's a lot of hype around something that may or may not make a difference, but actually there hasn't been such interest and potential in something since really the internet about 25, 30 years ago. So I do think this is a moment in time when there are going to be new approaches to thinking about how we do what we do, new approaches to dealing with our data. And I think public health needs to think about how to embrace those new methods. Number 3, I think we need to think about new partnerships. The traditional model in health has been for academic institutions to partner with governments, for us to think of our remit as being largely governmental or paragovernmental organizations. There is I think, a growing understanding that one builds new partnerships by thinking about all sectors, including private sectors and other areas that build the society in which we live. And that requires a different way of doing things, a different way of starting to think about how public health builds what it does and how it builds what it does in partnership with less traditional groups who nonetheless are important in terms of generating health. And number four, I think we need to ground what we do in a clear understanding of what makes a difference in bridging the science, the scholarship, these partnerships to the end of making a difference, to the end of creating a healthier world. And that is an argument which certainly many of us have made over time, that public health fundamentally is a pragmatic discipline that is not in contradiction with saying that we generate ideas and that we are in the business of making sure that there are data available about the best possible ideas. But it does mean that we generate those ideas to the end of creating a better world where everybody can live longer, healthier lives. So thinking about making sure that our science is contextually relevant and relevant to our partners, and bridging the path between science, mechanism, translation, impact becomes a key part of what we do. So I think those are four directions, different ways of thinking, different ways of doing the work, forming new partnerships, and engaging in making sure that our work can inform policymakers to the end of making a difference. And I think these all can represent an important inflection point in the field, not one that comes out of nowhere, but one that builds on where the field has been coming and takes us to where the field is going to be going in the next 25 years.
Thank you.
Yeah, thank you so much. We'd also just love to hear a little bit about what the new School of Public Health at WashU is kind of doing to really live these four new principles.
Yeah, so we have been we've articulated what we call a 4x4 plan. Anybody who's interested can see this on our website. And a 4x4 plan takes those four new directions that I talked about and couples them with four strategies. And our four strategies are, number one, to make sure that we have faculty and staff who are committed to building a school that moves forward in these new directions. Number two is to lean into a distinctive educational programming that reflects where these four directions are. Number three is to ground everything we do at the school in interdisciplinarity, something we call Public Health Plus, which means you can't actually have new partnerships. You can't train people for new partnerships unless you actually build, as part of the DNA of the school as something that's tightly woven across disciplines, across the university, across the community, across the country, across the world. And number four, a school that cares deeply about local to global impact. So as you can see, I think by having faculty and staff leaning into educational programming, building Public Health Plus, and caring about local global impact, these four strategies map onto four new directions of new ways of thinking, new ways of doing the world, thinking about novel partnerships, and thinking about ways to make sure that our work actually makes a difference. So four new directions where the world is headed, four strategies. So we've been trying to map that on and be intentional about making sure we build a school that is responsive to where the field is headed.
No, yeah, that's very amazing. And so we'll move on to our second question now. It seems like no matter what the issue is, we as a society are trending towards taking very polarized views for the sake of partisanship and pressures like social media only capturing headlines without nuance. This makes public health very difficult, as many ideas need large buy-in to work. For example, you recently wrote about vaccines. How can we as a public health community adapt to get broad public buy-in in the current cultural climate for important public health agenda?
Yeah, I think it's an excellent question. You know, when in the middle of COVID, when the world was all wrapped up, as you know, in a lot of challenges about vaccinating people, I would often get questions from the media saying, "Well, how do we get people to trust us?" And the answer, of course, is you can't get people to trust you in a crisis. It's like being on a drowning ship, and you say, trust me. It's like, well, if I don't trust you before, I'm not going to trust you now that we're in the middle of a crisis. So I do think that health has the potential to be, has been, and can be again a powerful unifying force. I think health is something that can transcend ideological divides. It can transcend other differences. You and I may, or Vish, may disagree on many things, but we both probably agree that we want our children to be healthy. Health is something that should bridge those gaps. And the fact that we have allowed health to align with partisan interests, which then make health an other wedge divisive issue, is really unfortunate. It really makes me sad. So I do think that we need to go back to basics, find a common ground that is, I care about health, you care about health, we all care about health. So health should be a unifying force. And to do that, though, we need to make sure that we meet people where they are. We need to make sure that we understand that our powers of persuasion need to be deployed in things we do, that we actually are not going to win over hearts and minds by the imposition of rigid ideological perspectives of our own. I have written about something I call radical incrementalism, which is we should have a radical vision, but we should be committed to the incremental hard work of getting there. Radical vision is a vision where we live in a world where everybody lives longer, healthier lives, and with all the systems and structures of the society align to make sure that's the case. Incrementalism means recognizing there are many entrenched interests in systems and structures, and as a result, we want to make sure that we work slowly together with societies to bring people along to understand where we are trying to be headed. Now, those are nice words, perhaps, but it's hard to do. I mean, take, for example, something that is very dear in the heart of anybody who is in public health, which is reproductive rights. This is in many ways an inalienable part of what the public health agenda is and should be. I should be clear, has been for the past decades. But it is very hard for us to wrap our brain around that there is a substantial minority of people in this country who have a coherent worldview that within it does not allow space for abortion, for example. So how do we actually find our way to persuading people in a way that we can align and recognize that ultimately reproductive health, access to abortion, is very much part of access to healthcare for all people, and deal with the underlying but coherent and deeply felt, honestly felt worldviews that are in direct contradiction with that. It is very difficult for us to do that, but just because it's difficult doesn't mean we shouldn't be trying. So I think we need to understand where people are, think about how to produce the data, think about how to do the act of persuasion to bring people along, and recognize that the most effective way of bringing people along sometimes is not through insisting on the correctness of our approach, but actually sometimes it may require a deep engagement with understanding where people are coming from, particularly if they come from different places than us.
Thank you, Dr. Galea. Those are amazing points. I kind of want to go back to your authorship. I know you've authored around 20 books, yet much of public health research, really lives behind paywalls and maybe buried in jargon. What have you learned about writing for the public, and what do you think we as a field get wrong when we try to communicate our work?
Yeah, well, first of all, I want to be clear that there is absolutely nothing wrong with the disciplinary work. I think, in fact, the foundations of our work should be the hard work of the science that produces data that are published in peer-reviewed journals. So I want to make sure that in my answer to the question, we do not lose that the foundations of all ideas and the foundations of ideas that are about the generation of health should be about data and about the science, and that is by definition the provenance of expertise, and that's okay. That's number one. Number two, I do think that collectively we have a responsibility to translate the science, and I think we should translate the science in any way that works to our strengths. I've written books, I do long form essays. I don't really do engagement with social media. I don't really do engagement with, let's say, video. And I think those are all important areas of translating the science, which others should do. I think we all need to ask ourselves, what is our strength, and how can we be part of translating the science? Sometimes I get asked this question by people early in their career, should I be, while I'm doing scientific papers, should I also be producing things for Instagram? And my answer is, you should be doing where you can be effective. I don't think you as an individual need to do all things. What I think you as an individual should do is be part of institutions that are willing to engage with translating the science. You yourself should maximize what it is that you're good at. And some people are better at others in translating in different ways. So I don't want anybody to leave this with a sense of, well, it's on all of us to be involved in multiple aspects of translating the science, because some of us have particular capacities in that, some of us do not. Fundamentally, coming back to the role of science, science is about generating data that understands the world in the context of population health. Science is to the end of giving us the data, the evidence that point to a healthier world. That is what science should be. That has utility in terms of being the foundation for ideas in society. We have a job of producing the science, teaching it to our students, and translating it, and creating the mechanisms through which that gets out in the world. And that should be our collective job.
All right, thank you.
Amazing. Many of us here at SEAL care about health equity due to personal experiences. We just want to hear a little bit about what personal experiences shaped your own early interest in the social side of health. What was there a moment that made it more than just a theoretical concern for you? And what moments over your career have reinforced these ideas?
Yeah, I was trained in a fairly traditional medical school, went to University of Toronto Medical School, and I was trained to be a clinician. I think I was trained very well by people who meant well. And but that view of the world had left little space for the notion that health is not just the product of biological mechanisms under our skin, that what happens under our skin is a product of the social environmental mechanisms in the world around us. So that was something which I had to learn, which I had to absorb, which became a part of how I saw the world as I matured in the field. I worked as a physician. I worked as a clinician in pretty rural, remote, isolated areas. I was trained as an emergency physician, primary care physician. And in those areas, I realized that the uh, the production of health ultimately is outside the body, that I am healthy or I am sick yes, in part because of my genetics, but in larger part because of the world I live in, because of the air I breathe, the water I drink, the food I eat, whether I exercise, whether I have the resources to be able to take rest at work, whether my work is dangerous, whether I'm living in a society where I run the risk of being shut down in the street. Those are the forces that shape most of health. And so I became motivated to think about how do I learn about those forces. And that's why I went back to school and did a master's of public health and a doctorate of public health. So for me, it was a bit of a late awakening. I mean, you all, I suspect every single person of you in this webinar is more sophisticated about thinking about the health of the public than I was at your stage in life. And well, that's a good thing. I applaud you all for it. It took me longer to figure it out. But I came to it through this clinical journey and then a bit of a dissatisfaction with with how much a clinical perspectives can contribute to what I really cared about, which is creating healthier people.
Yeah, thanks. That's very insightful. Kind of reminds me of the goldfish metaphor that you sometimes read about. Um, Also, you've written really powerfully about, the moral purpose of public health. I'm really curious, how has your own sense of that moral purpose evolved over time? And I guess, how do you stay grounded in it amidst political, institutional, or even personal pressures?
Well, that's a big question. I suppose the mission grounds me, to be honest. I care very much about what we do. I think it's a noble mission. Um, um, and I think that keeps me, you said grounding. It's a good word. It's a good word. I'm not sure if it keeps me, I mean, I hope I'm grounded. I try to be anyway. Um, uh, I, I get up every day and I think I'm part of something that's larger than myself that I care about. And I find that very important. I could have taken a different path. We all could take different paths where the outcomes are different. And that's not to diminish any path. I think everybody needs to choose their own path. For me, a path which has clear mission and purpose is very motivating. And knowing that I'm part of a world of ideas that are pragmatic towards creating a healthier world, that keeps me grounded.
Thank you.
Amazing, thank you. Looking back over your career, what are the things you felt allowed you to make the most impact, and what are the things you would change if you had to do it again?
Well, I think what allows one to make the most impact is what one does in partnership. In the introduction, you were kind to point out what I've done, and I haven't done any of that by myself. I mean, it's all been done in partnership. And if you look at my publications, they're all in partnership with others. Many of them with students, many of them with colleagues with whom I've worked for years and decades. So I find um, uh, I think one makes the most impact by being effective at working with others, bringing others into the tent of the intellectual work that one is doing, and moving forward those ideas together, because that multiplies and extends one's work. What would I do differently? It's a good question. I perhaps would worry a little bit less about the small things, but it's very hard to see outside of your own space when you're dealing with the small things. That's the truth. I think I'm at a stage in my life where I feel like having engaged in this mission-driven work, having done it with some great people, I feel blessed, and I feel like I want to do it for a few more years, make a little bit more contribution, and then hand it over to you all.
It's very warm to hear, Dr. Galea. I guess before I open it up to questions from the audience, I have one final question from all of us. If you were our age right now, what are the main questions you would seek to answer? Can be within anything and areas of impact to pursue.
Yeah. I think you know, it's always tricky, right, to look where the puck is going versus where the puck is. But I think there are some things that are pretty clear where the world is headed, and those are largely driven by large demographic changes. So the world is aging. That's not going to change. We know that the world is going to be about 2/3 of people in the world are going to be older in by 2050, for example. You all at this life stage, in 2050 you're all going to be at your career peak, right? It is going to be a much older world at that time. So I think aging and creating a world where people can age healthy and where one can figure out ways to capitalize on an older population is going to be something that's very much squarely important. Number one. Number two, the world is urbanizing. We know this. More and more people are living in cities. That comes with real opportunities. How does one build healthy cities? It also comes with challenges in terms of how does one make sure that increasingly isolated rural communities are not cut off. That's another important demographic shift. Number three, warming climate. Climate is warming. We know this. It is a non-partisan statement that the climate is warming, that as a result, there are more natural disasters, that these have real implications for a number of health indicators. Number four, mental health. Mental health has now become much more destigmatized than it ever was in my career. There are going to be more and more people who are actually interested in mental health, which I think it creates an opportunity. Number five, population migration. There are today, this year, I just checked the data the other day. I think in the past year, there had been about 200 million people displaced in the world, while 7 years ago, it was one quarter of that. Like population migration, shifts across borders are going to increase. So what I'm saying is, I don't know precisely what the health issues you're going to be dealing with are. Neither do you, but we do know that these demographic trends, where they're headed, and you can anticipate what they're going to be dealing with. So I would encourage you to say, that's where the world is headed. That's where those of you who want to be where the world's needs are going to be need to be thinking about right now.
Yeah, I mean that's amazing advice, and I think that's those are very, very tangible and predictable events that will occur, and so we need to be thinking about them now to deal with them in 25 years from now. And so let's open it up to the floor. I think Justin submitted a question, so I'll read it out. What are some useful strategies that physicians, public health professionals, and even elected officials can employ to build bipartisanship in order to promote policies that support and enable healthy, active, and hopefully long lives? And after this, if people want to raise their hands and ask directly, I encourage you all to do so.
Yeah, thank you, Justin. I think my answer to this goes a little bit to what I was saying earlier. I would suggest we need to understand that the unfortunate an unfortunate feature of the human experience is that we share the planet with all sorts of people who disagree with us. Now, I say the word unfortunate wryly because it is, of course, a wonderful thing. It would be a very, very boring, very narrow existence if we're only surrounded with people who agree with us. So we'd have to understand that people disagree with us and disagree with us all the time, and that we need to get better, get good at, get better at engaging people with whom we disagree and making sure that we can actually share our we can share our perspectives, that we can persuade by building on our data and align those who are in a position to create a healthier world to advance agendas that we think are important for the world. That is not easy. For anybody who's interested in this, I recently wrote an essay about this in my blog, which is roughly weekly. It's called "The Healthiest Goldfish," and about how we actually can how we think about ideas from people we disagree with and how we incorporate them. So I actually wrote specifically about this topic. But I think the fundamental, Justin's question is useful strategies. If I were to go back to one useful strategy, it is a depth of compassion. It is a depth of compassion, and it is, I don't know, Arnav and Orvish, just pointing to you just because you're on my screen, where you come from, right? Like, I don't know why you think the way you do, but I can have compassion to say, well, if you have ideas that you feel strongly about, I want to respect that, even if I may disagree, and I want to respect it and engage you with your ideas towards trying to find a common path together. And notice I'm using the word compassion rather than the word empathy, because the word empathy means I can put myself in your shoes. Empathy means I can understand how you see things because I can put myself in your shoes. Well, I don't need to put myself in your shoes in order to respect what you're doing. I don't need to do that to respect what you're doing. And that's where I would push us towards compassion.
Amazing. Thank you. Yeah. Would love if people want to raise their hands. Otherwise, we do have some other questions that were submitted we can go through as well. Let's go with Sid.
Hi, Dr. Galea. My name's Siddharth. I've been working on the Healthy People paper with you, and it's been a pleasure to learn from you and really write this. That's one of my first papers that I've ever led, and I'm really proud of it. And I've learned a lot during that time. And thank you for coming on here. I really enjoy reading your work and listening to you speak. And my question is, you talked about this 4x4 plan and how the fourth part of this is really how in academia we generate ideas and we have to really work to turn these ideas into creating a better world. So building on that, my question would be, it seems like there's a growing amount of literature being published every day. And if you look at a chart annually, it's continuously rising. And healthcare is a sector where adoption of certain technologies and certain ideas is probably slow, maybe for good reasons, and some maybe not because of good reasons. But I wanted to ask, how do you think we can really bridge that gap between the amount of literature being published every day and the implementation side of it, the integration side of things? And building on that, if you think this is a real problem, how can we redesign the incentives around academia, and how can early career professionals like myself start trying to make an impact in that area?
Well, first of all, nice to meet you in two dimensions.
Yeah.
So wait, I'm trying to understand the question. I'm trying to reduce it to something which I can actually answer. Give me your top line summary of your question.
Sure. So the summary is basically, it seems like there's a lot of literature being published, right? And it's continuously rising every year. And I feel like a lot of the literature is not necessarily leading to implementation, because the idea of all this literature is to create some sort of impact to make this world a better place. And if our population health goals are continuously worsening and we're publishing more literature, how do we bridge that gap is my question, right? And is that an academia incentive issue, or is it an issue with the type of work we're publishing? Those are kind of the questions.
Yeah. I understand why you're asking the question, but I'm not sure that I see the foundations from the same perspective. Let me explain what I mean by that. What is the job of the academy? The job of the academy is to generate ideas, okay? And you never know which ideas are going to matter. And it is okay to generate ideas. That is what our job is. Societies invest in universities and academic institutions so that we can generate ideas. And the fact that we generate more ideas, we should not be apologizing for that. Now, it means we should do things that are good and solid and robust and we think make a difference. Some of you may know the name Milton Friedman. Milton Friedman was what is called a neoliberal economist. He was actually the intellectual architect of much of the turn towards more conservative economics in this country. I disagree with much of what Milton Friedman said, but he had this quote, which I really like, and you can find it. I'm not going to get it exactly right, but something like this, which is, things change really when there's time of crisis, or essentially when there's opportunities for things to change, okay? And you never know when that time's going to happen. So he said, our job is to generate ideas so that these ideas, and he used this term, are lying about so that when there's an opportunity, these ideas can be picked up and acted on. Milton Friedman spent 20 years essentially sort of wandering in the desert and nobody listening to him until Ronald Reagan came to power in 1980. All of a sudden, his ideas were lying around, and they essentially they architected the entire Reagan revolution and the economic model that moved this country into a much more individualistic, smaller government approach. I'm not saying you or I need to agree with that. I'm simply stating the facts, okay? That happens all the time. I'll give you now a much more personal example. If you go on Google Scholar and you can look at my publication, you can look at my most cited publication. My most cited publication was about the mental health consequences of the SARS epidemic in Toronto. It was published with a group of researchers in 2003 who approached me, asked for my help. I worked with them. We published this paper about the SARS epidemic in Toronto and the fact that it had consequences for population mental health. And you know what happened when we published that paper? Absolutely nothing. Everybody ignored the paper. It was published. I don't know if you had any citations, maybe one or two, et cetera, et cetera. The paper was published in 2003, okay? Then guess what happened in 2020, 2021? All of a sudden, there's the COVID outbreak. And when COVID happened, that was the only paper out there that had documented a population mental health change in response to an infectious disease pandemic. And that paper went from being a paper sort of a little bit like in my back shelf that nobody ever read to becoming my most cited paper within the span of a year. And that paper influenced a lot of people who did a lot of work in then studying the impact of COVID-19 on mental health. That was 20 years in the making. A good colleague of mine was the person who wrote the paper about showing the link between gas stoves and indoor air pollution, which was affecting people's asthma, which then resulted in changes in EPA regulation, changing regulation about gas stove. He wrote that paper in 1998. Guess what happened when he wrote it? Nothing. Totally ignored until 20 years later, all of a sudden it became an issue and people were like, here's an idea. This is the idea. This is the paper. And things happened. So there's a challenge with saying, look, I want to do work that matters right now. Now, I do understand that earlier in one's life stage, there is an impatience with wanting to change things right now. And I don't want to dissuade you from that. Go for it. Be impatient. That's fine. Lean in. But I also want you to have the wisdom to realize if you do good work, you're creating ideas that are going to be lying around for the right moment and somebody will pick them up and you got to have that confidence.
Yeah, I completely agree with that. I think it's a very novel perspective. I never thought about academia like that. I never thought about how someone could publish something maybe in 1990 and then in 20 years down the road, it becomes probably the most important piece of literature. So I'll definitely take that perspective with me as I continue on my academic journey. Thank you so much.
Yes,
Something
thank you. Go ahead, Bob. Sorry.
Thank you, Urvish. And once again, thank you for speaking with us, Dr. Galea. Something that I wanted to ask, actually as a follow-up to your last point, is about how one effectively translates research into impact. You recently became the editor of JAMA Health Forum. It's an outlet that I read with great and enthusiasm. And you'll actually be happy to know that our group here at the Social Equity Action Lab recently published in JAMA Health Forum examining the issue of the data quality and evidentiary standards that the FDA uses when they're approving AI, ML enabled medical devices. Yet, even after that work is out there, it's unclear to what extent or effect the FDA will modify its regulatory processes in order to actually mandate more stringent data from these device manufacturers. And so I offer all of that as context to ask a simple question of what will it take for us to more effectively translate research, even from esteemed journals such as your own, into tangible action that affects health care overall?
Yeah, I mean, there are many different regulatory bodies that are involved in, what these regulatory bodies do, right? They're trying to create guardrails. They're trying to create guardrails so that what we do is doesn't go off the rails, literally. I think there's a criticism of those regulatory bodies that they slow things down too much. In general, I'd like to think that in normal circumstances, I'll come back to that in a second, regulatory bodies play a really important role in making sure that we as a society can innovate, but do so without harming each other. We are not in normal times. I mean, we're in times where a lot of these levers and mechanisms are being used to change, and not change, that's the wrong word, to advance particular preordained agendas. And that is unfortunate. That is unfortunate. And I think I'm hoping that our systems are robust enough to live through the moment, because fundamentally, we want expertise to guide regulatory organizations, and that is to the benefit of the health of the public.
Thank you so much. I think Bradley has a question, so we'll let him ask.
Yes, thanks. Thanks so much for being here and thanks for putting this on. I wanted to ask a really specific question about healthcare affordability and focusing on the cost of care, knowing that that's only going to get more complicated with like an aging population and increased like proportion of Medicare enrollees and all that. My question is, what are the most important trends that are affecting like researchers or innovators in this space that we should be aware of as undergraduate medical students, or maybe things that we can get involved in to sort of help learn more about that and experiment with that.
And Bradley, you're referring to trends affecting research in general, or specifically about a particular area?
Trends affecting healthcare affordability that are being researched on or innovated on.
Yeah, with an interesting, it's a super interesting question, because it's such an interesting and difficult field in this country, that we have such expensive healthcare, but at the same time, very good healthcare as long as you can get it. But the drivers of affordability are fundamentally cost of pharmaceuticals, cost of physicians, cost of therapeutics, diagnostics, right? Those are really the key drivers, as well as the threat that results in cost increase of malpractice suits and all that, right? These are all the key drivers. Very hard to figure out what one can do about any of them. If anybody's interested in this, probably the health economist who I think has written most lucidly, most accessibly about this is David Cutler. I would encourage you to read his work. But I do think that in the list that I just sort of rattled off, I think pharmaceuticals, physician payment of people within healthcare systems, the costs of litigation, the costs of diagnostics. There is work being done in all of these. I think there's work being done in all of these. I think there's innovation being done in all of these. Center for Medicaid and Medicare Services does some innovation projects that tries to look at cost regulation. There are multiple sort of projects being injected all the time into the system. I think there's interesting work being done about them. I mean, the journal that I edit, JAMA Health Forum, is publishes papers about affordability and access all the time. So not to promote the journal that I happen to edit, but if anybody's interested in this topic, just getting the table of contents weekly from JAMA Health Forum, I think you'll get a sense of really where the cutting edge research is in this area.
Thanks, Dr. Galea. We have a question here from Sai. Given the current political polarization and erosion of public trust, what is the single most important action we can take today to rebuild confidence in public health and effectively address future health crises? And in your view, what is the most pressing ethical challenge facing public health today, and how should we navigate it?
Oh, that's not one question. Those are multiple questions. Let me start with the
We can
trust.
go with the first one, yeah.
Okay, the first one, yeah. No, they're all good questions. I'll try to tackle them. I don't know what the single most important thing is to do to build trust, but I do know that we should have the integrity and wisdom to do good work, do it honestly, and be humble about how we present it to the world with a due recognition of its limitations of what we don't know. I feel like, I alluded to this earlier. Once I say to you, trust me, I've lost you, right? I think you're going to trust me much more if I say to you, look, I'm not sure what the answer is. Here is what I think the answer is based on what I know, based on the expertise that I've accumulated over reading and learning and studying over the years. And I'm going to present to you what I think is my best answer. And you can then decide what to take from that and how to weight that, right? As soon as I say it that way, it is much more trustworthy than me saying dispositively, trust me, here's the answer. So I think we need to learn how to convey that better. In terms of the second part, which, by the way, you'll notice that I actually used the opportunity to present to you my answer in exactly the way I'm suggesting we present answers, and now you can decide for yourself whether you trust my answer or not based on how I presented my answer. The second part of the question was, the biggest ethical challenge. I mean, I think there's a whole range of ethical challenges, but I do think that one of the things that is really difficult is how do we wrap our brain around making sure that people do what they need to do to generate health without overly imposing. Like, I think some of the challenges that emerged during COVID, for example, about enforcing lockdowns and like balancing the trade-off between collective good, individual needs, figuring out where we stand on that, are really difficult. I'll give you one concrete example because I think COVID is a bit of a, it's become like a lightning rod, right? I say COVID and everybody's like, hair stands up on end and, people start, getting their pitchforks out of their drawer and all that. But let me give you a much more pedestrian example, so to speak. Speed limits. The data are very clear. If you take speed limits in this country and reduce the speed limit every road in this country to 25 miles per hour, we'll probably be saving about 20,000 lives. So why don't we make speed limit advocacy a core part of public health? Well, we don't because we don't think about it, but we should think about it. And when we think about it, we realize we're trying to balance a lot of things. We're trying to balance a lot of social pressures about, that's something as very simple as wanting to get places faster, right? So this is, the question was framed from Sai as an ethical question. I'm not sure I'm giving you an ethical answer. I'm giving you what I think is a very knotty and difficult question about how do we find what we advance in public health, what we engage with in public health, how do we balance that with other social needs, social wants, social pressures? I think it's just a very difficult, it's a very difficult space for us to wrap our brain around. Ashwini?
Yeah, I can go next. I wasn't sure if someone else was in line ahead of me with their question.
Yeah, sorry. I think Aksa is next.
Go for it, Aksa.
Thank you, Ashwini.
You must be seeing something I'm not seeing because I don't see these.
I'm getting lots of messages, so I'm trying to just.
You're getting messages directly. Okay, got it.
Yeah. So
okay, go ahead.
Aksa, please. Thank you.
Thank you so much for being here. I think something that was interesting about what you mentioned was the role regulatory bodies play in kind of guarding innovation, placing those guardrails, and then the role academia places in essentially kind of creating ideas. From what I have seen, it's really legislative bodies and the political sphere that is controlling what ideas are being translated into the decisions that are affecting our day-to-day lives or the way that healthcare providers are able to practice. So in this space, what role and responsibility do healthcare providers and then researchers have in engaging as stakeholders in terms of policy development? at state or national levels?
Yeah, look, I think those who are in the business of health, and presumably you're all in the business of health, because otherwise you wouldn't be spending an hour on this Zoom call, have a responsibility to make sure that we tell the story of health so that those who are decision makers can make the right decision. One of the things that I often heard, let's say in the past decade, let's say before COVID, just to leave aside all of that, right? I would speak to health audiences and say, look, we spend more as a country on health and we have worse health outcomes than other high-income countries, something that you all know. And then people would challenge me afterwards and say, well, what do you want us to do about that? It's like, it's not us. To which my response is, well, it is us. Like actually we are, we speak for health. I don't know if any of you here are Dr. Seuss fans. It's like the Lorax. I am the Lorax. I speak for the trees. We are in health. We speak for the health of people, and it is not right for us to wash our hands and say, well, it's just those policymakers. They don't listen to us. If only they listen to us, it'll all be okay. And I'm like, that's not untrue, but it's sort of on us. I mean, it's a little bit like, to use another analogy, perhaps I'm stuck in a Seussical child frame. It's like a parent with a child saying, well, it's not my fault that they ran into the street. I told them not to do that. Well, yes, but you're still the parent, right? It's still ultimately your responsibility. So I take it very seriously. That's our responsibility. I think it's my responsibility. I think it's your responsibility. So I think we need to take that to heart and ask ourselves all the time, what is it that we can do to do our job better to create health? I'll go back to Sid's question, sort of several questions ago, when he was asking about how you do papers and the matter and everything else. And as I said in that answer to that one, I'm not sure exactly how to make sure all papers matter, but I do know that we have a responsibility to make sure every paper we do is as good as can be, so that we are investing in this responsibility as much as we can give it. I think that is should be a core part of our identity.
Thank you.
Thank you. I think Arian is next.
Hey, Dr. Galea, thank you for coming in and speaking with us. I just wanted to ask, in your 2025 essay of challenging health, you outline 4 major structural forces that shape our global health today, right? And I guess I just wanted to ask, of those 4 structural trends that you've pointed out, which has been the most under-recognized so far, and how do you think public health should lean into it during these next coming years, especially since public health is changing so much?
Yeah, I don't know that there's one that's been less recognized than others. I actually think that when I say to you that you should be looking at and you should be thinking about where demography and where societal trends are headed, if you want to think about where public health should be headed. When I say that to you, I think that must sound banal and obvious, but it's amazing how not obvious it is. It's amazing how much we stumble in that. So I don't know that there's any one area in this sort of demographic shift that we don't think about, as much as we just don't think of it in that way. I find population aging as, to use one example, it is astonishing to me how hard it is for that idea to penetrate, because that's not going to change. The demographic curves are abundantly clear about how we are headed to a more aging world. And that has implications for everything. For somebody else, I think Bradley was asking me about affordability and healthcare access, has implications for how we build our cities, has implications for how we structure our societies and how many resources we have that are generated by people of working age to support people who are not of working age. That should influence everything we think about as we think about the future. So I mean, we'll see if those trends are the right ones 25 years from now. But I tried to intentionally, Arian, focus on things where I don't see how these demographic will change. I mean, aging, the population aging, people living more and more in cities, people migrating more and more. These are, greater warming climate with its implications for mental health. The path is pretty set. I think these all matter.
Thank you so much. Yeah, I completely agree.
Thank you so much. I think Ashwini now.
Sure. Thank you for attending this session. I was really looking forward to it. So before I ask my question, I'll give you a little context of why I'm asking this question. I used to work on mental health in general, and also I had the pleasure of working with your data set of like mental health for Houstonians who have experienced Hurricane Harvey. But I've sort of transitioned now into looking for mental health for immigrants. And one of the things that I've discovered is like mostly that for people who are working with immigrants, data is a big problem, or getting the right kind of data that we want. So now I have a new dream of like thinking that one of those days I will be able to help on like curating a national data set for immigrants or specific kinds of immigrants, so that researchers like me are not limited by, well, data was not available for this group, so we did not include it in our analysis. So that's my dream. And right now, what it feels like a far-fetched dream with the governmental priorities shifting, especially for immigrants. So I was going to ask you if there are any recommendations or if you have any thoughts on like how to progress from a student and going on to such a big dream and making it a reality.
Yeah, I just put in the chat a report that we had done on data and social determinants for any of you who are interested. That came out in 2022, I believe. So Ashwini, nice to actually meet you in this way as well. It's nice to meet some of you who I've done some work with over email. You know, I want you to stick to your dream. Remember my point about radical incrementalism? That applies here as well, Ashwini. I think you have a radical dream. You want to make sure that there are data available. And why do you want data available in the context of, let's say, migration and immigration? Well, I think you want data available because data makes sure that populations are seen, right? Data is a way of bearing witness, and we should want data. It's very hard to get data around issues of migration. As a result, it's actually hard to document the challenges that faced by migrants. Hard to document the health challenges faced by migrants and what it is that we need to do to improve the health of migrants. So your radical vision of having data available is the right one, and I applaud you for it. So don't give up on that. The second part of it is do the incremental hard work to get there. You know, let's say your radical vision is, just for a second, right, that we have data available on every migrant, the entire set of social, economic, life circumstances they face, their entire set of health indicators, that we can track it over time and we can monitor. Let's say that's the radical vision for a second, okay? That's great. I don't want you to give up because you can't get to that vision. I think it's okay to have small wins along the way. Build how you can. Engage with teams that can move towards that vision. Take it a step at a time. Build one thing at a time. That's okay.
Thank you. I needed that.
Don't you know, you're all coming of age, and here's the bad news. The bad news, you're all coming of age in a time of real unease and turmoil in health. Here's the good news. The good news is you're all coming of age in a time of real opportunity in health. Lean into that.
Thank you. We'll do our final question from Aaron.
Hi, thank you so much for joining us today. And as someone new to public health, what practical steps would you recommend for getting involved in research that can lead to publications? And how do you personally identify research questions worth pursuing? And what key skills do you think are essential for producing strong, publishable work?
Well, let me address it backwards. Key skills, I think you should make sure that you are trained as well as can be in whatever training you are in whatever graduate program you're in. I would strongly encourage you to take the hardest courses, and don't take the courses that you think you're going to like. Take the course you think you're going to learn from. That's on the latter part of the question, okay? How do you identify research questions? Well, you need to make sure that you know the field to know what are the next set of questions that should be asked in order to be able to generate useful research questions. You know, one of the many aphorisms attributed to Albert Einstein is that, you know, what really matters is not the answer, is the question. And I sort of tend to agree with that. But now let me come to the first part of your question, which is, are I think, the important part. Well, look, you can't do it by yourself. You need to make sure you get yourself hooked up with mentors. So any idea that you have that you want to pursue, you need somebody who's going to mentor you. You need somebody who's done it longer than you have, who actually has a sense of how to do it right. Finding the right mentor is, it's not half the battle. It's like 75%, 80% of the battle. I would encourage you in all your contexts to figure out somebody who will be willing to mentor you. You know, one way to test people out, I'll tell you, it's very simple. Look up somebody on PubMed who's published a lot and look if they've published with many different people. If people publish with different people, it means they're willing to engage other people. It means they're willing to take the time to mentor other people. If you find somebody who's very prominent and on all their papers they're leading authors, you don't really want to work with those people because it's hard then to make a space for yourself. You want somebody who's actually has a track record of working with many other people, and those people are going to be good mentors to you. So find the right mentor. That will make a big difference.
Thank you so much.
Thank you for that wonderful advice, Dr. Galea. And with all of that, I also want to thank all of you for attending. As we wrap up, I'll just be sharing our Slack once more. And I just want to flag that we are working on some very exciting initiatives, including a governor's race happening next month, after which soon we expect to be writing health bills. We are also hosting more speaker sessions, much like this one. And if any of you are interested in helping us host those, feel free to reach out on Slack. With all of that, I once again want to issue a deep note of thanks and gratitude to Dr. Galea for being so generous with his answers and his time as well. We look forward to further engaging with you in the months and years ahead, and we are sending you all of our best. So thanks again.
Well, thank you all for everything you're doing, and thank you for leading in the next quarter century. I am looking forward to living in a world that you create. Thank you. Take good care.
Thank you so much. Thank you.